welcome Stefan, Iron Primary Care, here with Logan, who's come onto the show to tell us about urgent care and the appropriate use of it, if there is such a thing.
Yeah.
So we actually met in an urgent care. It was our first job out of school, and I worked there for about two plus years, and she still works in urgent care, not at the same place, at a different place. I also did locums work, meaning I traveled all over Florida, working for actually her company, so very familiar with different kinds of urgent cares and the different types of patients that come into urgent care. At Iron DPC, I don't want my patients to go to an urgent care. There's really nothing that an urgent care can do that I can't do for my patients. Typically, if patients need a higher level of care, I'll tell them. And typically a higher level of care is an emergency room, not an urgent care. However, there's a lot of inappropriate use of emergency rooms as well. And there's a lot of inappropriate use of urgent care as well, which is why we're making this video to describe when you should probably think about going to an emergency room and when you might need to use an urgent care. But pretty much the reason people use an urgent care is because they don't have primary cares that will actually answer the phone, see them same day or next day, which is what I do at Iron Direct Primary Care. I never have sent my patient to the urgent care. I've had patients go to the urgent care because they were not aware that I'm a primary that would actually see them same day for the problem and take care of it. So let's go over some things that if you're a patient that doesn't have a primary like me, what would be a reason to actually go to the urgent care?
So yeah, people have to realize urgent cares are pretty limited in what they can do, right? So people will come in for all sorts of reasons, but in reality, for example, I'll tell you my urgent care, we have access to x-ray, we have urinalysis, we have strep, COVID, and flu swabs, and RSV. So that's not much, right? So if you have something potentially dangerous, life-threatening, even something chronic, it's really not appropriate for an urgent care. So if you have like an upper respiratory tract infection, if you feel like you have a sinusitis, a bronchitis, possible broken bone, maybe an upset stomach, a UTI, those are urgent care appropriate things because they're generally easy, they're quick, they're not life-threatening, they're not chronic. It's still more or less, Band-Aid medicine, but those are more appropriate things, right? So things like severe abdominal pain, chest pain, true difficulty breathing, and I don't mean, your chest is tight. I mean like you feel like you can't breathe, those types of things. Those are not urgent care appropriate, right? Altered mental status, not urgent care appropriate. So people, I find they really don't understand what's appropriate for urgent care.
Yeah. So when I worked in urgent care, I'd see that all the time. They'd come in for chest pain and they have a cardiac history where they've had a heart attack before, maybe they have stents before. Do not come into an urgent care for that. Sure, I can run an EKG. EKG doesn't mean much. You still need to go to an ER. Urgent cares cannot do troponins. I don't know of an urgent care that does troponins. Troponin is a blood test that checks for heart breakdown, right? Muscular breakdown of the heart. It's a sign of muscular damage in your heart, which is not good. That's a sign of a heart attack. Can't do that in urgent care. You always need an EKG and a troponin to rule out a heart attack. You sometimes need several troponins. Sometimes you need to stay in the hospital overnight to measure these troponins. You do not come into an urgent care for chest pain.
Yeah.
Pretty much.
Well, and I often find too, people will check in and they'll say, I want to rule out a heart attack. I want to rule it out. Like, we cannot rule out a heart attack. What I can tell you is an EKG is only helpful if it's very abnormal. So if someone's telling me they've got chest pain, they're high risk, even if their EKG looks basically normal, I'm not going to tell them there's no risk of an MI because there's a large percentage of EKGs that are normal.
Correct.
On the first attempt in an MI. So you do need to get cardiac markers tested, and that's a blood test, and urgent cares don't do that, nor should they. That's the problem. Urgent care, we shouldn't be operating like an ER because we're not. if somebody codes in an urgent care, there's going to be a problem. You know, we're not equipped for that. But it's true. People say, I want to rule this out, but we can't rule that out. We just can't, and so it's just not appropriate. So if you have pain with coughing, or you press on your chest wall and it's tender, okay, those are reasons that it's appropriate to come to urgent care. Sure, when you cough, after some time it's going to hurt, or you may get some inflammation of the costochondral spaces, costochondritis. Those are okay, but if you have sharp pain when you're breathing, or like you're at rest and you have this pain, this pressure in your chest, even in your epigastrium, in the upper abdomen, we really can't appropriately rule certain things out.
Mm-hmm.
We just can't do it.
Yeah, and specifically if you have risk factors, right? If you're older, you got diabetes, it runs in your family, some heart attacks early age, and urgent care is not going to be able to help rule that out.
Mm-hmm.
Well, let's talk about antibiotic use. People always come into the urgent care. It's just, the only thing that ever helped me is the Z-Pack. Can you get me a Z-Pack? I had a cough this morning. Is that appropriate for an urgent care?
Absolutely not. And what's sad is I find that for some reason, I'm the first person to tell people this, which I feel is strange. Like their own doctor has never told them that the vast majority, statistically, like 90 to 98% of upper respiratory, sinusitis, bronchitis, it's viral, right? So, which means it's not going to necessarily respond to antibiotics, right? So there's a lot of other things that may help. Steroids can make you feel better, NAD, glutathione, nutraceuticals, but in reality, when the vast majority, almost 100%, is viral in nature, the Z-Pack isn't doing anything, right? So you might get better in 5 to 7 days and think it's the Z-Pack, but it was just simply because your body fought off the virus in 5 to 7 days. But for some reason, people don't actually know this, and I do a lot of education on this in the urgent care, and it's pretty shocking to me.
Mm-hmm. Yeah, bacterial infections in the lung. So what does azithromycin do? It doesn't actually even get rid of them. Azithromycin is a bacteriostatic antibiotic. It inhibits the bacterial replication. So azithromycin is used all the time. I think it has a little bit of an anti-inflammatory property, which is why people think they feel better with it. It might be because of that. It's anti-inflammatory. If we're looking at anti-inflammatory properties, we're looking at nutraceuticals. We're looking at glutathione, NAD, vitamin C, quercetin. We're looking at off-label prescribing like IBM, HCQ, methylene blue, stuff like that. Not necessarily azithromycin, but people come in all the time for it.
And at least, that's probably a more benign one,
Right.
right? So that's much more benign than the penicillin-based antibiotics like amoxicillin, augmentin, doxycycline. And granted, there's a time and a place for those, for sure. But in reality, you should be asking your provider if you absolutely need this, not begging them for a penicillin-based antibiotic after 2 days of sinus pressure.
And the thing is, when you go into an urgent care, a lot of these, they don't even call them patients now, they call them clients.
Mm-hmm.
And so when you go in and you ask for something, typically you're gonna get it at an urgent care unless you meet, me or you, we wouldn't give you this stuff.
Yeah.
But if you run into most urgent cares, they treat you like a client because you're actually paying them, so they're gonna get you what you want. And whether that's the best thing for you, probably not. They're just trying to make you happy so that you come back, right? It's capitalism combined with healthcare, for better or worse, right? Ideally, you'd want to have a primary who can really educate you on this and knows what's best for you long term. They are going to then have to deal with the abdominal injury from antibiotic use, the GI, the microbiome upset. So I typically don't want my patients to be taking antibiotics because then I have to deal with the repercussions of this, right? It's more work for me. As a DPC, I try to make it less work for me. I try to improve my patients' health quality so they're not so sick all the time. In urgent care, however, they make more money if you come back and always get the same antibiotic. Whether that injures you, it doesn't matter to them because they're not really dealing with that. They're just dealing with the acute thing. What's happening now? Let's give you this, right? Let's give you the pill. So, again, antibiotics, they can be helpful, but I think they're massively overprescribed, and I was taught once by one physician I worked for that you never get sued for what you do to a patient, you only get sued for what you don't do. So this mentality of prescribing all the time, give the drug, because if you don't, oh, what if something happens, right? So that mentality also influences a lot of American healthcare, is to overtreat, and it injures a lot of people. And that's the unfortunate reality of that, is there's actually a lot of healthcare injury out there, right? Can we think of a real use of the antibiotic? Okay, cellulitis of the leg, right? You got a bad skin infection of the leg, right, great. Augmentin, fantastic.
Yeah,
okay?
I mean,
Bactrim, fantastic.
Cellulitis is okay. Obviously, you have a consolidation in the lung. I mean, a true opacity on the X-ray. You've got a pneumonia.
Well, what if though you get kicked by your rooster? Should you run into the urgent care and go get an Augmentin?
No, I would say. I mean, and again, it's just like you said. Everybody's different, right? It's a case-by-case basis. A 70-year-old with diabetes, hypertension, CHF, like I'm going to take those into consideration,
right,
with antibiotic prophylaxis. But I'll tell you, for example, I was out in the yard and our rooster punctured through my foot, right? And those are dirty feet. That's pretty nasty. Obviously, first thing I did was clean it with saline, Heba cleanse, right, and soak it. But people come to the urgent care for animal bites, puncture wounds all the time. And there's like this algorithmic approach of like, put them on Augmentin,
right,
give them a tetanus shot. And in reality, like a 25-year-old with no comorbidities who's pretty well, putting them on prophylactic Augmentin versus possibly a watch and wait approach with, of course, soaking with some, antiseptic solutions is kind of harmful in my opinion. Right.
Yeah.
I obviously did not take any antibiotics. I just soaked the wound and I kind of dealt with it for a couple of days from the discomfort. But yeah, I mean, not everybody. This isn't cookie cutter medicine. It's not a one size fits all.
But the unfortunate reality is you have to see a lot of patients and you have to make them happy. And a lot of patients will expect the antibiotic. And if you're working for a corporation, if you're working for someone else, they'll expect you to prescribe the antibiotic as well. So there's a lot of pressure on us, especially as PAs, to make the patient happy, to give the drug, so that they can come back and you can generate revenue for the business.
Mm-hmm.
But it does cause a lot of harm to overprescribe like this, practicing in a worst case scenario sort of mentality, which is kind of like how we were trained in PA school.
Pretty much.
It was always to think of worst case scenario so you don't miss anything, and it does lead to sometimes some unnecessary prescribing.
Mm-hmm. And I think, the general public understands somewhat about antibiotic resistance. Okay, most of them understand that, but what they don't understand is the other side effects, right? Like colitis with the penicillin antibiotics, as well as severe gut dysbiosis after penicillin antibiotics. Sometimes even like doxycycline can be known to cause yeast overgrowth. Fluoroquinolones are notorious for causing mitochondrial dysfunction. They can cause psychosis, tendon rupture. That's why, I would say about 80% of the people that come to urgent care, they have fluoroquinolones listed as their allergy.
Aortic dissection.
But it's not even an allergy like an anaphylaxis or a rash. It's some severe reaction they had after taking a fluoroquinolone, which is not an allergic reaction, but an adverse reaction. And so that's what I think most people don't understand is we're not being mean by telling you that you don't need this or we want to withhold it from you. It's because we don't want to give you another chronic issue because of it for something you don't need. And so that's a lot of my day is spent trying to educate people on these side effects that they've never heard of or they didn't even put two and two together. And for some reason, like me in an urgent care, I'm the first one to tell them this, which is always really weird to me because I'm not their primary.
Right. The one thing that a lot of urgent cares do get right is they don't hand out narcotics. That's usually banned. We don't do that in urgent care. So,
or benzos.
Or benzos, diazepines, so these kind of addictive substances. That's at least off the table.
Mm-hmm.
That's something that maybe can happen in the ER, but even in the ER, it's only for probably like a day or two. And they would typically only be for, an actual fracture, a broken bone or something of that nature.
Mm-hmm.
Which,
And we should touch on too, like chronic stuff, you know, like
Yeah.
an urgent care and an ER. First of all, the ER is for possible serious or life-threatening issues. You should never go for something minor, and you should never go for something chronic. The urgent care is for minor issues, and again, you should not go for something chronic because, again, we don't really have the capability to fully work it up. Sure, I can give you a differential of things it can be, no doubt. But at the end of the day, if you come in with back pain and numbness and tingling in your leg for 6 months, I mean, you need an MRI, you know, or, you know, I'll give you an example. If you've had like IBS type symptoms for a couple months, yeah, I could give you a couple things of what it probably is, but it's still not the same as meeting with one-on-one with a primary and really getting a full workup, right? So chronic issues, yes, you might find a provider who can definitely give you some possibilities of what it may be, but if you've had something for, you know, 2-3+ months, you need to get a primary and you need to get one who's going to work with you to figure that out. Don't go to an urgent care because chances are they're not going to help you. And if it's anything that's like sinusitis or even you've been coughing for a couple months, they're just going to throw antibiotics at you, to be honest, and that's not helpful. That's because it's probably, you probably don't need that. If you've had sinus pressure for 3 months, it's probably, you know, something a lot deeper than that. But that's what they'll do.
Yep, every time. Yeah, the back pain is a very common reason to visit emergency rooms and urgent cares. And I worked for Dr. Duke at the Duke Spine Institute, and he was like, well, we have an urgent care here. Why don't people come into us? We're the back specialists. But people don't know that that exists, that, you know, there's people like Dr. Duke who will see you sometimes same day for your back pain. But patients will go to the ER for this, and they'll go to the urgent care for this. And what you're gonna get is typically steroids. You get some prednisone, it's kind of like the wonder drug in medicine. Steroids kind of fix everything. And yeah, it can get actually some people out of sciatica flare. It can work pretty well. But, you know, ER would appreciate it if you don't go in there for your back pains. You know, it's not really an urgent care problem. It's something chronic, like a chronic back pain flare, right? We rule out the really bad things in the ER. If you come in with back pain, we're thinking, okay, wait, does he have a kidney infection? Okay, does he have a fracture, a cauda equina? Like, we're thinking worst case scenario. That's what the ER is thinking. Worst case scenario, rule it out, follow up with your primary. That's what the ER wants to do. But people will use the ER for all their chronic issues, you know, oh, my back pain flared out, and so forth.
Well, I think people too, they've also got to learn a little bit not to be so discouraged by the ER because that is what they're there for. They're not there to diagnose like an array of symptoms you've had for 6 months.
No.
Sure, you might get lucky and have an amazing provider who's like, hey, this might be what this is, but that's not what the ER, and to be quite frank, what the urgent care is for. You know, we're there to fix what we can right then and there. And again, the ER is, okay, you're not having an MI. Okay, you know, you're not in respiratory distress. Don't get discouraged that you don't get an answer because they're just trying to rule out anything serious. And after that, you know, it's on your primary to be working with you to figure out.
It says it on every paperwork that you'll get from the ER. Follow up with your primary 3 to 5 days. Whether you can get a primary that will see you in 3 to 5 days is another story.
Yeah, that's the problem.
But that's what the ER says, and it's correct. Their goal isn't to fix your long-term problems. It's to rule out the worst case scenario so you don't die that night, and then you follow up with your primary to fix what probably is a chronic issue that wasn't going to kill you that night anyway. Urgent care is kind of a band-aid medicine. You use some antibiotic, give you some steroid.
Lacerations, or abscesses and stuff too we can do, and that's kind of a that's a band-aid too. Yeah,
fix up a wound, easy enough for an urgent care. Lance and abscess, pretty easy for an urgent care. Yeah, they can do that.
Very, minor procedures like that I do frequently. Laceration repairs. I do INDs. Sometimes I'll drain up, paronychia and the finger. Take out fish hooks if most of the time those are easy. You can do that. I would say those are urgent cares for the most part. Can do the small procedures. Now, I've had people too that have come into urgent care and they've had like a growth for like 8 months or stuff like that. Like you need to see a specialist, possibly a dermatologist or even maybe a general surgeon, depending on what it is. that's not the appropriate place for an ER and urgent care to remove a growth that's, you know, been there long term, right?
Yeah.
Because it needs to be biopsied too.
And sometimes general surgeons, you can call them up and you can get seen,
Mm-hmm.
right? You don't even really need an appointment for
Mhm.
some general surgeons.
Yeah.
Same with a lot of orthopedic offices. If you have an orthopedic injury, you call up the local orthopedic. They'll probably see you same day. A lot of these places even have urgent cares,
Mm-hmm.
right? They want the business, and they're probably the best place to go for an orthopedic injury,
Absolutely.
right? It's not really the urgent care. It's not so much the ER. What's the ER going to do for a broken bone? They're going to splint you, and they're going to tell you to follow up with the ortho.
Mm-hmm.
You can call up an ortho and say, hey, I hurt myself, can you see me same day? Chances are they'll say yes. I know a couple who will do that.
Mm-hmm.
So it's worth a try before trying to go to an urgent care or ER for that. What else? Oh yeah, dental pains. Dental pains is not an appropriate use of urgent care or ER. You want to see a dentist for that. Right? We get essentially no training in dentistry in school.
Yeah.
Right?
Pretty much. Yeah. It's really lacking, I feel.
No dentistry.
And I do want to touch too on the abdominal stuff because that's a big thing I see. Because the problem again is, especially with corporate medicine, most of them, it's numbers, right? So they want one provider to see 30 to 50 people. Therefore, we don't have advanced imaging because people would be there for hours, right? Again, like the ER. So, you know, some people really may not know what's appropriate, and that's fair, right? And part of that is, that's what we do in urgent care. We're traffic cones. If we think you need to go to the ER, we'll send you. If you have an upset stomach, you know, maybe some diarrhea, that's okay. That can be an urgent care appropriate thing. If you have moderate to severe pain in your abdomen, particularly one part, you know, maybe you're having fevers, things like that, that's, again, probably not urgent care appropriate because you may need imaging, right? I would call your primary first and foremost, and if they can't see you and you're having moderate to severe pain, again, particularly in one area, it's really not urgent care appropriate because, again, the only thing we can really do is, you know, UA, which probably not helpful. An x-ray of the abdomen, not helpful. It's only going to show me, you know, gastric bubbles, and if you have an obstruction, you know, it's okay for maybe an obstruction, but then again, if you have an obstruction, you've got to go to the ER. So again, with abdominal pain, people really, they don't really understand that what's appropriate because it's really not. Moderate to severe pain in your abdomen is not really an urgent care appropriate visit.
Typically not. And an urgent care will always, you know, typically cover their ass and tell you to go to the ER for that. Now, with me as a primary who knows my patients, you know, I had a guy come over here to my house yesterday with belly pain. He told me that was his symptom. I had belly pain. I was like, all right, let me see your belly pain. Guy had flu. Right? I gave him an injection of NAD and glutathione. He was better the next day. Right? It wasn't like a real belly pain. It was inflammation from the flu. I see that in kids pretty often too. Kids will complain of the belly pain. It's usually not appendicitis. Usually they're constipated. If you know the child, you understand them. You know, if you have a primary who knows the family well, you can usually tell. But if you're seeing a child for the first time with urgent care with belly pain, you probably send them to the ER.
Yeah, you know, and some of it's, you know, clinical gestalt. I mean, I have kids come in and they complain like it's belly pain all the time, but then I go in and see them and like they're laughing, they're running around the room,
That too.
They're jumping up and down, like that's okay. They're not actively having tenderness. I mean, I rarely see truly sick kids in the ER.
Yeah,
in the urgent
that's
care,
true. There's not a lot of sick kids.
Yeah.
And I can't really think of too many times I sent kids to the ER.
Yeah, it's mostly the middle-aged and elderly. When they come in with abdominal pain, I'm definitely more concerned, and that some of that is because an elderly woman with, you know, upper abdominal pain, that could be an MI, right? That could be pancreatitis, that could be anything at that point. And so that's what makes it so difficult when older folks come in with like moderate to severe pain. It's again, urgent care is just not appropriate. We don't have all the right tools.
Yeah. Yep. Very good. That pretty much covers all of it.
Yeah, I think so.
Yeah, very good. Hope you all enjoyed. Good.
I feel like I got